You know, it's a good bet that Maya and Juno, two happy mastiffs, probably outweigh their owners. But they don't push their weight around.
Gentle giants. They are true, just like a draft horse. Love to go with you, are happy, just as happy to stay home. And I think they're pretty protective, and we have a young family, so we're happy about that. Come on, Maya, Juno. Good girl.
But one of them, Maya, hasn't always been happy.
She ended up having to go to the emergency clinic. She was depressed, not eating for a solid week.
And it all had to do with Maya getting spayed successfully, but in a traditional, more complicated way.
The bigger the dog, of course, the more technically difficult the surgery is, and there's a little bit more risk as well. Because when you have a large breed dog, a big giant dog that's over 100 pounds, especially one that's older, when they've started past puberty, you run the risk of having a lot more bleeding.
Maya did recover after a painful and traumatic week, but Juno's trip to her spaying couldn't have been more dramatically better.
It was about one day that she was kind of sleepy, and then we just had to keep reminding herself, oh, this dog just had surgery, and to do the leash walking, but it was so minimal.
That's because the minimally invasive surgical technique common in humans, using a thin laparoscope to help complete the operation, is now getting more common in animals.
When you have a normal giant dog spay, you usually have an incision this big, sometimes this big. You have to go in manually, you have to break down all the tissues, you have to suture things together. With our scopes, we have tiny little incisions. We just insert the scopes, we just cauterize the tissue, we take it out, and we're done. Post-operatively, dogs are pretty amazing anyway. They handle pain so much better than people do, but post-operatively you can tell they stretch a little bit more, they lay down, they wag their tails, they're much happier.
And it was all due to getting spayed successfully.
Ended up being less than half as far as cost-wise goes because of the complications of having to go to the emergency clinic and transferring our care somewhere else for that time.
The equipment is very, very expensive, but it's come down from what it used to be so that now we can make it affordable to the pet owner, which is good.